Okay, good morning. Welcome to the press briefing of the UN Information Service here in Geneva. We are going to start immediately with a briefing on the situation in the occupied Palestinian territories. We have with us Dr. Akihiro Seita, who is the Director of Health at UNRWA. As you may have seen, we've distributed it to you this morning. UNRWA has published a health program annual report, and Dr. Seita is here to tell us about it. I also wanted to remind you before we start listening to Dr. Seita, the statement by the UN Special Coordinator for the Middle East Peace Process that we have distributed to you last night about the airstrikes in Rafah. So I give the floor now to Dr. Seita, and please have your initial remarks, and then we will open the floor to questions. Thank you.
Good morning. Thank you very much for good gathering. And my name is Seita. I'm the Director of Health of UNRWA. UNRWA covers not only the occupied Palestinian territory, Gaza, West Bank, including East Jerusalem, but also Jordan, Lebanon, and Syria, where we have in total around 6 million Palestinian refugees since 1948 or 1950 when we start operations. I briefly talk about the entire UNRWA operations in these 5 fields, we call it, and they go to the West Bank and Gaza in a couple of minutes. So for the health report, which clearly say that the UNRWA continue the services under such a difficult timing, not only Gaza and West Bank, you know, Lebanon is economic crisis, Syria is also insecurity prevails, and we never stop any services. And last year, we provided services around 7 million consultations. So it's a quite good number. And the 2 million Palestinian refugees use our services because some of them come multiple times, which includes that 300,000 people with diabetes and hypertension. Because of prevailing poverty and difficulty in lifestyle, diabetes, hypertension is quite predominant among Palestinian refugees. And also that we took care of that 70,000 pregnant women, and almost all of them, except for the current Gaza, that almost all of them deliver the babies in the hospitals. So it's a quite good coordination with the host government of Jordan, Lebanon, Syria, as well as Palestine. And also we have an increased number of mental health and psychosocial support. And last year we treated 33,000 patients with mental health. We introduced WHO MH gap, and this 33,000 includes that the depression, anxiety, and the other mental health conditions. So it's a very good, robust primary health care services. Of course, it is supported by the 3,200 staff. It's a great staff. Almost all of them, except me, are Palestinian refugees. They were born there and they studied there. They came to our services and provide the services to their own population. I think that's a good reason that we have extremely good commitment, and we have a very good electronic medical records. It is a cloud basis. It's connected 140 health centers and day to day, and so many of the health centers are paperless or digitalized, and recording that medical condition, the prescription by the digitally. And we also have a smartphone applications. One is for the mother and child food, pregnant mothers. So far, 270,000 mothers using these applications. And the diabetes, hypertension, or non-communicable diseases, around 200,000 people using this application. So UNRWA is quite a robust primary health care with a long history of good quality of services, and the indicator of which you can see the annual report, because second half of the annual report is all the data, and you can see this. Next, West Bank. The West Bank situation is very dire. We have 40 plus health centers, but it is very difficult to move. Say, typical example that health staff who are working health center X may not be able to reach the health center on time. So what we did is we reallocate the staff, and so that the people living near that health center can go to the health center to work. And so that we do not have a disruption of the provision of the services. But it's very difficult in the West Bank, and particularly the incursion, and some of the health centers are affected, and that is also our main concern. Now let me go to Gaza. I was in Gaza last month, 3 weeks, and then I still can't forget what I have seen, or I still cannot how do you call it, reconcile of what I've seen in the brain and the mind. Is it correct expression? Yeah, the correct expression. And then so I went, because of my job, I went to Gaza many times, particularly Gaza City. Then I went there on the 8th of April. I really couldn't understand where I was. When I saw the street, when I saw the buildings, I really couldn't understand where I was. It's a big shock to me. But nevertheless, I'm very proud to tell that the UNRWA never stopped services. We provide the primary health care. At this point of time, 7 health centers. I need to check today, but it was 7 health centers yesterday. And then also 105 medical points, which are all in the shelters. We have still quite a large number of shelters. And so we provide the primary health services in these health facilities. And every day we treat almost 15 to 20,000. And sometimes 25,000. Before the war, the average daily consultation in Gaza was 15,000, so that we are catching up and we're providing services, not only the refugees, which accounts for the 70% of the population, but the non-refugees as well. We treat everybody. And then that the health condition is dire because of the lack of the good water and sanitations, that we have still very high rate of the acute respiratory infections, diarrhea, including bloody diarrhea, as well as hepatitis A. This remains still high, and then that's our main concern. And then also that the mental health is on the rise, but we do as much as possible. And then that access to the hospital services, we are working very closely thanks to WHO and the international partners, that we try to have access to the health services, hospital services to the Palestinian refugees, others. But all in all, again, that as I said, that we never stop services. We continue to provide the services and include the vaccinations. And then we started vaccination from the beginning of the year. And so far, we have 100,000 children vaccinated. And so it's a quite good catch up to the pre-war level. And thanks to the community, because their mothers are very much keen to vaccinations. Nutrition. We do the MUAC, which is the middle upper arms measurement. And our data is still preliminary, but it shows that there is an increasing trend of the malnutrition. Less than 2 years in the southern part of Gaza, that 10% of kids, we found that are acutely malnourished. And we're working with the UNICEF and others to provide a hyperalimentation treatment. So Gaza situations are, again, very dire, and we do our best. But because of this massively deteriorating situations, what we need now is ceasefire. We continue to do whatever we can do, but without ceasefire, without peace on the ground, peace in mind, we continue to suffer. And I'm sorry to say that the people in Gaza may continue to suffer. So ceasefire is highly requested. That's okay? That's all. Thank you. Thank you very much, Dr. Sita, and I'm sure there will be lots of questions. I also wanted to mention, I should have done it before, the tweet that Antonio Guterres, our Secretary General, posted last night about the Israeli airstrike, where he said, I condemn Israel's actions which kills scores of innocent civilians who were only seeking shelter from this deadly conflict. There is no safe place in Gaza. This horror must stop. I'll open the floor to questions first in the room as usual, and then on the platform. Isabel Sacco, the Spanish News Agency.
Good morning. Yes, it's. Hello, do you hear? Yes. I would like to ask you more details on the situation in West Bank. How the incursions by the Israeli forces have affected the services in the health centers. And you mentioned you had to reallocate staff to live near the health services. But if you can explain a little more on the situation there, on a daily basis, how the work is happening, if people can access the health centers also to seek for services, for health services. Thank you.
Yeah, we answered the question.
Yeah, thank you very much. Yes, that from us, the major problem is that how to continue the services to ensuring the number of staff in the health centers to come. When I was there at the beginning of the year, I can share one example I faced, that I went to one of the health centers where that some of the health center staff could not come. Then they called the head of health center and told them that I'm here in the checkpoint for 3 hours. We couldn't move. So they asked the health center staff, what should we do? The health center staff said that you can go home, and then that kind of situation continues. And so that we make sure that where that the health staff can access, then we reallocate the staff to go to the health center to continue the services. But in the hype of incursion, of course, our center is closed, but after that we open it and then make sure that the people have continued access to the services. That we are going to do this. Yep. And so and the other problem is the movement, that our main warehouse of medicines are in Jerusalem, because as I'm sure you know that our front office is in Jerusalem. And then so the moving the medicine from Jerusalem to the West Bank is always challenging. That we are working closely with the Ministry of Health and other partners, make sure that when the medicine in the warehouse could reach the Hebron or Ramallah or the Nablus, that's what we're going to do. So it's extraordinarily challenging. Yeah. Thank you.
Do you have a follow-up, Isabel?
Yes, very quickly. If you have any idea on what kind of health problems are increasing because people don't have access to the medical services.
Sorry, it's on, no?
Yeah.
One is on the rise is mental health. And you can see in the statistics in the report, so I don't want to refer to the inaccurate number, but one is on the rise. But also the NCD are on the rise, but it is continuous. So our aim is to make sure that they have access to our services, and also that access to the specialized services in collaboration with the Ministry of Health.
Yes, please. Can you introduce yourself? I know that you come from the Lancet, but...
Oh, there you go. Quite loud anyway. Could you reflect on the financing side of your work? Because obviously it's very challenging and you're having to treat and see so many more individuals. Thanks.
As you know, I'm the director of health, so that I'm not in the best position to answer to the financial situation, but let me share what I know, and the detail you should contact our office. At the beginning of the year, that because of the allegation that the 16 countries stopped the financing. Today, 14 countries resumed, 1-4. So it's a good sign for us, but because that we still have not yet reached the sustainable financing level. So at this point of time, what we have is that the next month, June, cash flow is okay. Until June, cash flow side is okay. After that, it's still challenging.
Emma Farge, Reuters.
Good morning. I don't know if you, amongst your healthcare centers, you have kind of trauma centers, but I'm wondering if any of them were dealing with the injuries from the Rafah airstrike Monday night. What did they see? How were they able to cope with that? And just a broader question on medical supplies into Gaza. Have you had any in at all since the Rafah operation began? And how dire is the supply situation for you? Thanks a lot.
Yeah, thank you very much. So for the yesterday's one, Rafah, I'm not updating myself, so I come back to you later. But in general, as I said, that we have 7 health centers and 105 medical points. When I went to the health center as well as medical points, I saw lots of injured people coming to a health center. It's simply because the hospital overwhelmed. And so they cannot keep the patient long, so they come to a health center. So the wound, dressing change. And then that our health center and the particular medical point are not the best place to have a clean wound change. So we are working with the WHO to have the wound care, so that the people come here that should be able to get the clean dressing and the wound care. And that's the one of the main issues. The place I went in medical points in mid of April, late March, around 20 to 30% of the patients coming to our medical points are for wound care. And that's also a big burden. And so that's why we are trying to do this. The supplies I understood that the Karam Shalom opened the day before yesterday. So that I hope that the medicine goes in now. We have 2 routes that our office is exploring together with other UN partners. One is Arish, and the Egyptian side, the other one is the Jordan side. And working with the World Food Program to make sure that we can send the medicines there. It has been challenged, if we go back a little bit history, that at the beginning of the war, that we had a major warehouse in Gaza City. And if you remember, the 1 week after the start of the war, that we needed to evacuate to the south to continue the services. And we lost all the stock in the central warehouse of medicines. So we ran out of the stock very quickly. And then since then that we've been there, what we did is we bought all the medicine for 6 months. And because of this support to the international communities and also the government of Egypt, that they reached by the end of December, almost all of them reached. So that's a good sign. However, that we see that what we call the consumption of medicines some of them increased drastically in comparison to the pre-war. One of them like relating to the wound care, because we did not deal with the wound care before the war, but also the antibiotics and some anti-diarrhea medicines because of the very poor hygiene conditions. I forgot to mention that in our latest statistics still say that in the shelters we have 1 toilet for 800 people. And then 1 shower for 3,000 to 4,000 people. It's simply because we have too many people to care. So but it results in the increase in the diarrhea and the hepatitis. And so medical supplies, we still have a reasonably good stock now, except for some medicines we have an increase in consumption. They're really hoping that either the Arish Rafah route or Karam Shalom route or the Jordan route resume or open, and so that we can send the medicines from these places.
And we have Dr. Harris from WHO who has something to add to answer Emma's question. Please, Margaret.
Yes, on the supplies, I've got an update on where we are with that. Certainly the medical supplies and the fuel supplies are running very, very low. We've managed to get 3 trucks in through Karam Shalom since the Rafah incursion began. And we have 60 WHO supply trucks waiting at Al Arish, unable to cross into Rafah due to the closure of the border. Fuel is particularly critical, as you know. The estimated requirement is 200,000 litres per day, and we have been able to get in approximately 70,000 litres per day at best. Some days none, so that's an approximation over what's been able to get in. So all the hospitals are really struggling and making decisions about what they can do. We have 14 hospitals that are officially still functioning, but what we call functioning, often they're not accepting inpatients, and they've had to limit what they can do, particularly in Rafah. Only Emirati Hospital remains barely functional, and there are 5 field hospitals, but all are overwhelmed and undersupplied. And so this means that the key health services are just not available in Rafah, including dialysis, medical imaging, surgery, pediatrics, internal medicine, and maternity care. I've got a lot more detail if you want it, but I'll give that later.
Thank you, Margaret. And I see that James has raised his hand, maybe also to answer Emma's question. Good morning, James. James is our spokesperson of UNICEF.
Yeah, hi.
James, you're on.
Good morning, everyone. Hi, Emma. Yeah, just to add on what's happened in the last 3 weeks since the invasion of Rafah, remembering the limited, quote unquote, limited invasion of Rafah, which has now displaced around 1 million people. But when it comes to water, as of today, both desalination plants in central and southern Gaza have shut, one for 18 hours and one for 8 hours. So throughout this past week, 10% of the required fuel has got in for those desalination plants. So when we were talking about, on average in Rafah, a person getting around 1 litre of water per day, catastrophically below any emergency level, we are now again multiplying by fractions based on the closure of Rafah and a ongoing military offensive there. Thanks.
Thank you, James, for this update from UNICEF. I'll go to Nina Larson, AFP. Nina?
Yes, thank you. I was wondering, I had a few questions. I was wondering, can you hear me? Yeah. If you're talking about receiving, wound care in your health centers, but can you describe sort of what kind of injuries are coming in, and also are you handling births, women in labor, women giving birth, and also amputations and things like that? If you could just sort of give an impression of what you're seeing there. And then in terms of the lack of fuel, I know that there were warnings at the beginning of the Rafah operation that all humanitarian assistance would ground to a halt. With the 70,000 liters going in per day, how limited are your operations, would you say? Thank you.
Thank you very much. So, sorry. The wound care, what we saw, all the wound is treated by the hospitals. And then the operations, amputation, whatever, fracture, they do it in the hospital. We are primary healthcare providers, so we have no operations room. We have no surgeons to do this. But once operations finish, that they stabilize, in the ordinary setting, they stay in the hospital longer, or they go to the hospital outpatient to wound dressing by the specialists. But the hospital totally overwhelmed, as you heard this. So these patients will come to us. So what I saw is quite all the range of the people, including amputations. That for the wound care, we do not do the suture, all the things, just to change the wound, clean the wound, and change the dressing. That we are doing this with all the different types of this one. If you remember that in several years ago, that a couple of years ago, we have a great march of return in Gaza, where lots of injured had the same sort of situation, and they came to a clinic for the wound care. And that's what we are going to do, and what we're trying to do. And the other one's labor are all done in the hospitals. We have, with the help of the UNFPA, that we have midwives in our shelters, but they are not there to meant to the deliveries, but they are meant to support the pregnant mothers and babies. So far that the majority of the delivery done in the hospitals, and we took care after the birth. There's a very limited number of deliveries at the shelters, as far as I know. Okay. Yep.
Thank you very much. Margaret, do you want to add anything to that?
I think, again, because of the limitation on fuels, decision is made every day about what it's used for. I mean, because it's used for the generators for hospitals, but it's needed also for the bakeries to try to provide some food. It's needed for the desalination plants, as James mentioned. So everybody's making very, very difficult decisions about what can be done. I mentioned dialysis, the lack of dialysis. The one little bright spot is the dialysis services have returned in Nasser General Hospital, and I understand also they're going to begin to do so in Al Shifa. So it's extraordinary how, despite the massive destruction and the difficult circumstances people are working under, what you said, the people keep on coming back and restoring services as best they can to keep on serving the people. The other big issue actually is lack of medical imaging. You talked about trauma care. When you've had your bones smashed by a bomb or other trauma, you need the doctors need to be able to see where they are to put them back in a way that helps you to heal. There are no CT scans working. There's about one in the north. In the rest of the south of Wadi Gaza, there isn't a CT scan. So you can't actually see. You have to really fly blind. All the work that the doctors and nurses are doing, they're doing their very best, but they know they're not doing what they really could do if they were just allowed to provide the level of care and services they could provide before the 7th of October.
Thank you, Margaret, for this update. I have Beyza Donmez, who is our correspondent of the Turkish news agency.
Thank you, Alessandra. I have two questions. Firstly, I want to ask about, can we say that, lack of fuel entrance and also, ongoing strike, especially after the Rafah attacks, those increase the number of needs of medical evacuations? How many do we have a rough number, and is it taking place or not? And my second question would be more broad UNRWA question, but you can maybe comment from the health point of view. Yesterday, EU Foreign Policy Chief Borrell said that Israeli parliament has been starting to study a law to declare that UNRWA will be forbidden to act and work in West Bank and in Gaza. How do you evaluate that, and what would it mean for your operations in the region, and what would it mean in the health sector? Thank you.
Dr. Steven.
No, I got the second
start?
one, and then
Yeah.
can answer the first question.
Okay,
medical-
go ahead.
Yeah,
Yeah,
medical
go ahead with the second question.
Second question. Thank you very much. I'm not in a position to answer or respond to what Israel is discussing now, but what I can say is this. UNRWA is critical and essential for the people in the West Bank and Gaza. We cover 70% of people in Gaza for the primary health care, quite a large number of them. And at this point of time, 60-70% of patients are seen by UNRWA for the primary care. So that without UNRWA, it is extraordinarily tough situation. They already went beyond the limitation, but it's very tough. So what I would say is UNRWA is critical, essential, and providing the service needed to the people. So continuation of UNRWA is extraordinarily important.
And I like to back this, as we have seen several times at all levels, the UN Secretariat, all our officers, including at the highest level, we've been saying it repetitively, that UNRWA is the backbone of the humanitarian operation in Gaza. No other entity has the capacity to deliver assistance to the people of Gaza and, of course, of the Palestinian territories. Margaret, on the issue of the evacuations?
So on the issue of the evacuations, there's been an abrupt halt to all medical evacuations. Now, I think, as you know, we normally have around 10,000 people who need to be evacuated. And since the increase in the violence in the area in Rafah and the limitation on the services, we now have an extra 1,000 critically ill and injured patients who've been unable to leave Gaza to receive the much needed medical treatment elsewhere.
Thank you very much. Just for housekeeping, I've got Jamie here in the room, and then 2 questions on the platform, and then we will go to Papua New Guinea, which I know is also quite high on the news, and we will listen from the colleague in Bangkok. So
Thank
Jamie
you.
Keaton, Associated Press.
Margaret, could you just elaborate on well, 2 things. One is that you just mentioned that the evacuations have come to an abrupt halt. When was the halt? I mean, when did that begin? And then the second question is, going back to what Emma had asked earlier, can you provide us some more details about the aftermath of this strike that happened over the weekend, in terms of the casualties that you've seen or that you've heard reported, and the type? For example, it looks like there's a lot of burns cases. I mean, I don't know, we've talked a lot about malnutrition and crushed bones and whatnot, but we haven't often heard about burns. So do you have the proper equipment in place to treat burns like they were? Just anything that you can shed greater light on what happened from a health perspective on this over mishap, as Prime Minister Netanyahu described it over the weekend.
Thanks, Jamie. On the sorry, my brain has just gone. Oh, it's since 7th of May. So no evacuation since the 7th of May. And indeed, after the horrific incident, not a mishap, a horrific event, which WHO deplores the attack on displaced people who were sheltering in tents in Rafah. The numbers I have so far from the Ministry of Health reportedly killed 35 people, including women and children. The injured were treated by a WHO-supported trauma stabilization point, as well as in the 5 field hospitals that are being run by UK Med and IMC field hospitals, but it absolutely overwhelmed them. And you're quite right that many of the people would have suffered from terrible, terrible burns. And that requires intensive care. That requires electricity. That requires high-level medical services. Increasingly, we are struggling to even have the high-level skilled doctors and nurses because they've been displaced. They were all displaced by the incursion in Rafah, which meant they left wherever they were working. It's an enormous struggle for all the medical teams to meet the needs. And this is one of the hardest things for a doctor or nurse. You know, you want to help, but you don't have what it takes. And you are watching people who shouldn't die in front of you because you simply either lack the tools, the skill, or the supplies to do what needs to be done.
I'll go to the last two questions. John Zarocostas, The Lancet, and Franz van Catre on the line.
Yes, thank you. My question is to Dr. Sita and also to Margaret and James. Yesterday, Dr. Tedros mentioned that over 18,000 surgeries had been conducted in Gaza. Do we have a bird's eye view on how many of these trauma surgeries would have been for amputations, in particular for children? And if you have an update on that, and to what extent many of these amputations will be due to these 2,000 kilogram bombs that are often used in Gaza? Thank you.
Who wants to start? James has put his camera on. Should I start with James, maybe? Yeah. James, since this is really on children.
Yeah, no, my camera was turned on by the moderator. John, we crunched that number with the Ministry of Health in November that is well known now around that 1,000 children had been single or double amputees. And that was late November. And unfortunately, to the best of my knowledge, given, as we've heard time and again, the systematic destruction of the health system, a new number hasn't been updated. To anecdotalize for what it's worth, there are a lot of children in tents in Rafah who should be getting the best of medical care, as Dr. Harris has explained, in fact, are sitting in tents having had amputations. So beyond the physical need, the psychological stress is immense. They are in those tents. They are nowhere near the medical support that they need. And just to extend on what Dr. Harris was saying, this, we've heard this called a tragic mishap, a mistake. I guess the question is, what then to call the ferocious attacks that have killed thousands and thousands of children? How do we describe the actions that have pushed an entire population to starvation? What do we say to, as your question, John, what do we say of those countless children who've had arms and legs amputated, or the thousands who've been orphaned, right? What is the language used to describe the unprecedented devastation to homes and schools, to the uncharted territory of trauma of children? I think then surely the question that needs to be asked is, how many more mistakes is the world going to tolerate?
Thank you, James. I don't think there's much to add to that. Unless, Margaret.
I was just going to say to John, it's not simply the bombs, it's the lack of infection prevention and control, the lack of being able to provide the level of surgery that could save a limb. Decisions are having to be made by doctors to remove a limb to save a life. And again, that's a horrible, horrible decision to have to take.
Lisa Schlein, Voice of America, our last question.
Yes, thank you. Good morning. First, a question for Dr. Sato. I was wondering regarding the West Bank, whether there has been or there is any interference by the Israeli Defense Forces and the settlers for the ability of people to access the health care that they need, or whether it's fairly routine. And then for you, James, if you could kind of describe a little bit more about how well, if the mobile, I believe there are mobile stabilization centers in Gaza, around Rafah and so forth, how well they are operating, how you see the situation of what is called famine or starvation, whether you believe this has really kicked in, and whether children are, as we are speaking, starving as a consequence of this. Any numbers that you might have regarding the levels of malnutrition and so forth? Thank you.
Dr. Seita.
Yeah, thank you. That I do not have exact number, but when the incursion or that the settlers' violence happens, targeting the camps of ours in the West Bank, it affects the access to the people to the health centers naturally. And that's also a major issue that when they need urgent care, and when the camp is closed, that some of the camps do not always have hospitals, and so we have to wait until the closure is open so we can send the patient together with the PRC, Palestine Red Crescent, to send the hospital. So yes, it is affecting the case. I do not have an exact number, but it is a very serious situation. Over.
Thank you, James.
Yeah, hi, Lisa. Look, we don't have updated malnutrition numbers but beyond those that were shared a month or so ago that showed imminent famine in the north and vastly multiplying nutritional situation in the south. What I think that agencies have tried to explain, and it's difficult to piece together given the horrors of 7 months, every day in Gaza simply gets worse. So now, as we've seen since the 7th of May and the lifeline to Gaza, Rafah, largely being closed, getting no aid through Rafah. So we will see a continual deterioration. Kamal Adwan, you'll have heard that hospital referred to in the north. It's a hospital I visited a couple of times. It's the only one doing pediatric care for severe acute malnutrition. It came under attack in the last week. So again, its operability has been damaged severely. Attacks have continued in Jabalia at force. Those people in Jabalia who were unable to move based on financial means quite frequently 7 months ago. Yes, so their state is again absolutely perilous. When the United Nations advocated, Lisa, for Erez crossing to open because Erez is 10 minutes away from mothers hunched over skeletal children, absolutely no need for those children to be in that precarious position. When the United Nations advocated for Erez to be opened, we did so in the knowledge that that cannot be a cynical move to enable this offensive in Rafah and then Rafah to shut. That, as it is, has transpired, and that will mean that the nutritional situation, which was already hanging by a thread, people's coping capacity, the UN's ability to get food to people, that has only deteriorated. And we cannot for a moment pretend that the humanitarian response is anywhere near what we would like it to be, what it should be, and what it's needed to be by the civilians in Gaza.
Thank you very much. Nina, we have so many people waiting, so really fast, please.
Yeah, it was just a follow-up. Sorry, it was for Margaret. It was about the abrupt halt to all medical evacuations. I was just wondering if you have any idea of how many people, or if there are people who have died as a consequence of this lack of evacuation. If you could give us just a few more details on that. Thank you.
I don't have numbers of people who've died, but whenever we analyze who's waiting and who's gone through, we do have a number of people that have died waiting. So this is exactly what's happening, that while we're waiting for agreement, and this is before medical evacuations came to a halt. So while we're waiting for an agreement, a percentage of those people who are waiting to be moved die. And I do have the numbers not in front of me, but I can provide those numbers from prior to this abrupt halt. So, and given the sort of relatively chaotic situation and people moving and medical nursing staff and so on moving, I doubt I'd be able to give you clarity on who has died since being identified as needing to be moved since May 7, but I can give you those numbers from before.
And I see other journalists nodding, so maybe that would be something of interest to everyone. So thank you very much. We conclude. Yes, of course, please, sir.
Thank you very much. Just at the end, I just want to refer to our staff, 1,000 health staff working in Gaza. And then some of them are unfortunately killed, but we still maintain the services. And the majority of them are already displaced multiple times. And then some of them are leaving the tents, coming to a clinic to work. Some are leaving the shelters and coming to the medical point to work in shelter. Really would like to attribute my sincere admiration, respect, and thanks to them. But just I want to share one word that they told me. One of my friends working in Rafah, he moved out of Rafah because of the incursion. And before moving out, he just sent me that, Seita, when the world is going to recognize us as human being. And I couldn't answer And I really couldn't answer, but my job is to make sure that he's not right. At the end of the day, I think it's the biggest challenge for us to prove that we are taking care of them as a human being. And that's the biggest challenge to all of us. Thank you very much.
Absolutely. Thank you so much, Dr. Seita, and good luck for the work, which is extremely important and difficult. Thank you. And thank you, Margaret. I have the feeling you'll come back later on, but thank you. Arigato. Arigato gozaimasu. Okay, so now the second question to treat, the second topic we have on our agenda is also high on the news, and it follows the horrific landslides in Papua New Guinea that has been happening during the weekend. We have sent you the statement by the spokesperson of the Secretary General, who said that the Secretary General is deeply saddened by the reported loss of hundreds of lives in a massive landslide in Papua New Guinea, and extended the heartfelt condolences of the Secretary General to the families of the victims, expressed solidarity with the people and government of Papua New Guinea, and expressed the work, the availability of the United Nations to support the government's response efforts. And offer additional assistance. And to tell us about this, we have online from Bangkok, Itai Viriri. I don't need to introduce you to Itai. You know him from his time with us. Itai, welcome. Sorry for making you wait so much, but I think it's very important that we talk to the journalists about what's happening in Papua New Guinea, where IOM is on at the forefront of the humanitarian response. And I give you the floor for your introductory remarks. Thank you.
Thank you very much, Alessandra, for the introduction. Hi, colleagues. Good morning. Let me start maybe by just clarifying some of the figures that we are aware of as of today. So as you've seen from a lot of the media coverage, the National Disaster Center has estimated that there are up to 2,000 people that are still buried under the rubble after the massive landslide that took place on Friday at 3 a.m. when most people were probably sleeping. The other confirmation that we got this morning from the provincial authorities is that collectively, the number of people that have been affected by this disaster are around 7,840, which is made up of 1,427 households. So this includes those presumed buried under the rubble, but also the 6 bodies that have been recovered so far. One aspect that we should certainly emphasize is that quite a lot of the people who have been affected by this landslide had actually moved to this area after escaping tribal conflict in other parts of the province of Enga. So these are people who are already displaced who are now having to move to other locations. The response is certainly underway with United Nations, mostly IOM, UNICEF, UNDP, UNFPA, and UN Women, providing support to the government, along with other international agencies. And what is needed now, obviously, is access to clean water. Quite a lot of the water that normally the community would access is already under rubble. So providing that along with food, of course, clothing, shelter items, kitchen utensils, anything that will try and alleviate the hardship that the people are facing right now. The other issue that is obviously facing the response is the area itself. It's still very unstable. So the rain is still falling, and there's always a risk that there might be further landslides. And the reality also is that access to the area for government and other agencies is quite difficult. Just today, this morning, one of the main thoroughfares leading to this area, a bridge there collapsed, and now they have to fix it to make sure that all the convoys that are going to provide support have access. The other issue, of course, is the government itself, through the National Disaster Center, has asked for international support to ensure that resources are mobilized very quickly to ensure all the people who need help get it as soon as possible. Another concern, especially when it comes to health, is because there's so many unrecovered bodies under the rubble. There's still water flowing underneath because it's coming down from the mountain. That water obviously will be contaminated, unfortunately, meaning that any sources of clean drinking water further down the mountain where the landslide occurred will be contaminated. So that's another aspect that needs to be dealt with. I think I'll stop here. Obviously, if there are any questions, we have teams on the ground at the site along with our UN agencies, partner agencies, as I've mentioned, but we hope to have a bit more updates, especially in terms of the recovery process. I should add on, I mean, this is obviously a horrible, horrible situation, but there was some good news yesterday. A couple were rescued after 3 days under the rubble. So I think until the local community or the authorities say stop, I think the rescue and recovery efforts will continue because you just never know. But I think there will come sadly a time when it's really a recovery process.
Ite, thank you very much. I understand. Maybe you want to ask him which number because there was some disturbance when you started your briefing. So Christian, I think, wants to ask you to repeat some numbers.
Yes. Hi, Itayi. Nice to see you on the screen.
Hi,
Could you repeat the numbers that you mentioned in the very beginning?
Of course.
Yeah, that's all I want to ask.
Excellent. So let me start with the number from the National Disaster Center, which has said 2,000 people they believe are still buried under the rubble. And then this morning, the provincial authorities, in meeting all the various agencies present on the ground, said the total population affected is 7,849, coming from 1,427 households. These include those who are presumed to be buried under the rubble, and also over 1,650 displaced people. The ones that I mentioned have actually escaped conflict elsewhere and came to settle in this region. Maybe just one, and talking of numbers, maybe just also add this other, I think, important number. The population of Papua New Guinea is 42% under the age of 16. So the expectation is that quite a lot of children would have been affected by this. Obviously, we won't know until the authorities get a clearer picture in terms of the number of casualties, fatalities. But if we judge, if we take it on the basis of the population of Papua New Guinea, yes, that's quite a significantly young population.
Christiane?
Sorry, just a clarification. 7,849 affected means what exactly? It's not people presumed under the rubble, no?
No. So let me clarify that. 7,849 is the number of all the people that have been affected. So this includes the 2,000 that the National Disaster Center has said are buried under the rubble. This also includes obviously the recovered bodies and over 1,600 displaced people. So only the government or the authorities are saying 2,000 are buried under the rubble. And of those 2,000, six remains have been recovered. And we have, as part of that population, 1,650 already previously displaced.
Thank you. Emma Farge, Reuters.
I was wondering if you could just give us an idea of whether you have all of the equipment and personnel really required to respond to a disaster on this scale. Is there enough on the ground in this remote location? And could you elaborate a bit more on the bridge collapse? How is that affecting the rescue and the recovery efforts? Are there other routes in? Thank you.
Thank you. So right now, the attempts from the authorities, especially the government and the defense forces, is to bring in the heavy equipment that can help with getting some of the rubble to reach the bodies underneath. So that's ongoing. But of course, as I mentioned, the access to the site is very, very difficult. The bridge collapse this morning is actually in a neighboring Western Highlands province, but the road where this bridge is leads to Enga province. So what has happened is that it has cut off the main Highlands highway, which leads to Enga. And it means that the alternative road, for example, that can take relief convoys to Enga adds another 2 to 3 hours. But we understand that the latest update is that they are working frantically to fix the bridge or find an alternative, find a temporary solution to this. So that's another dimension I think that certainly they're having to deal with. But one of the issues that they've certainly, the authorities have brought up is that they need a lot of engineering support. So the National Disaster Center has appealed through the UN to get as much support, engineering support, because obviously trying to get rid of the rubble, and we're talking not just rubble like soil, but heavy boulders, needs a lot of engineering support or heavy equipment that can do the job.
Yeah, sure.
The bridge collapse was because of the landslide conditions? It was because of the instability in the rain?
I don't have those specific details. We just know that the bridge collapsed. I have a photo, I think, that we may be able to share, and it does look like a very flimsy, flimsily constructed bridge. So it could be that maybe there was heavy traffic trying to head to Enga province. I mean, I can't speculate. We can always follow up and find the specific details. But this is just one of the main roads that will lead to Enga province. As I mentioned, there's an alternative road through the Southern Highland province, but that adds another 2 to 3 hours to the journey. We hopefully should have an update tomorrow morning as to how quickly they can fix the bridge, and if there are other alternative ways of bringing in the relief that is needed. Could be through air support, but again, this is a very hilly, mountainous region, so even air support is not always an easy option.
Thank you very much. Lisa Schlein.
Yes, hi. Good morning.
Hi, Lisa.
Sorry, how are you doing? Difficult. Sorry. Okay, I hear from media reports that the ground is still very shaky and that the situation is unstable. And I'm wondering whether you are concerned, others are concerned about the possibility of more landslides. And if so, what precautions are being taken in order to protect people from this possibility? And then has there been an international appeal for money, or do you anticipate that this will happen? How much, are people talking about might actually be needed in order to help this situation? Thank you.
Thank you, Lisa. Let me start with the second question. So the officials, especially the National Disaster Center, have appealed through the UN for international support. They haven't clarified any specific figures, but what we can say certainly from IOM side, and I'm sure other UN agencies will have the same, we've had donors reach us, like the usual donors, the United States, the European Union, and others reach out to say they're on standby to provide support. I believe Australia is already sending in actual heavy lifting equipment and the kind of equipment that is needed in this situation. An appeal shortly will be going out. I believe we are certainly working on an appeal from IOM, so hopefully that should be ready in the next day or so. It's really up to the government also to clarify what kind of specific needs there are. I mentioned the list of things that are needed now, like water, food, shelter, and so on, but obviously this all needs money. In terms of the conditions, yes, the conditions are very, very difficult. In some parts, there's still, the land is still moving in terms of where this rescue operation is going to take place, we still, as I mentioned, still have water underneath the rubble, so that is making the whole area quite uneven. So that also ensures that all the response efforts have to be done in a very, very careful manner, meaning that you don't want another disaster on top of another disaster. So right now, the efforts are being led by our UN disaster coordination team, along with the PNG Defense Forces and other actors. And again, we have to be mindful of the conditions that are prevailing there, and just try as much as possible to help the people who have survived this, but also, as I say, try and still do the recovery work that's needed. Because ultimately, whenever these tragedies take place, communities want the comfort and solace of burying their dead, doing what is necessary in their customs and cultures. So that's a very, very, very big aspect of this. And we're there to provide support to the community as much as we can.
Itai, sorry, I think Lisa had also asked about prevention. I don't know if you can say a word about that.
Sorry, I missed that, Alessandra.
Yeah, if she asked about if this is happening, we are providing, foreseeing that it happens again, what's been done to prevent or to prepare?
Well, I can't speculate, but this landslide that happened on Friday had not happened before in this area. So it's hard to say if it will happen again, but with the continued heavy rains and in the vicinity, obviously everything the soil is unsteady, and all the rubble is still some movement. I mean, we've seen some of the videos of even water coming out in some of the rubble, so that makes it even more uneven. So yes, unfortunately, we have to consider that it might happen again. As to what preparations the local authorities are doing, I can't say at this stage, but I think everyone is treading cautiously, even though this is a very, very urgent and desperate situation in many ways. We still have to tread carefully and make sure that we don't have another disaster on top of the current one.
Thank you very much, Itai. Don't see other questions for you, but keep us. Oh, sorry, I didn't see your hands. Sorry, Jimmy Keaton, you remember him from Associated Press.
Hi, nice to see you again. Could you just tell us what's being done to evacuate people to get them to safety?
Thanks, Jamie. So, I mean, this morning at the briefing with the provincial authorities, it came up that in case there was any further threat of a landslide, people will have to be moved again. I don't have specific figures. I know some media had came out with some figures of just around 8,000, but I cannot verify that. All we know is that they are ready and preparing to move a lot of the affected population to neighboring provinces. We have daily morning and evening meetings with the authorities, so hopefully we'll get a clearer picture maybe in the meeting tomorrow morning, and we'll certainly provide an update. But for now, I think everyone is operating on the premise that anything can happen. This is quite a very difficult terrain, and the fact that this has happened, having not happened before, means that it can happen again in the same locality. I'm sure you've all seen the visuals from above, looking at how the area is how the mountain slopes and how vast also the area is. So I think caution is certainly key here, but at the same time, there's that urgency.
Indeed, impressive images. Okay, so I don't think I've missed any other hands up. Thank you very much, Itai, and please keep us informed also on the question of the funds. I think it's of interest to everyone here. Thank you, and good luck with your important work. Let me go now to our last topic of the day, then we will have some announcements. David is waiting, but let me go now to Tommaso Dalla Longa for IFRC. Thomas, can you introduce us your colleagues? Thank you.
Thank you, Alessandra. Hi, everyone. So we are, as you know, we are here today to launch a report called Climate Change and the Escalation of Global Extreme Heat. This report highlights the role climate change played in increasing the number of extreme heat days around the world over the last 12 months. And today we have with us Dr. Frederique Freddi Hotto from World Weather Attribution and Imperial College in London, who is one of the co-authors of the report and will brief us about it. And also online there is our colleague Maya Wahlberg, another co-author of the report from the Red Cross Red Crescent Climate Center, ready to answer to questions, particularly on the work done by our teams and on the upcoming Heat Action Day next Sunday. Thank you.
Thank you very much, Dr. Otto. And you are you're coming to us from London, I understand.
Yes, thank you.
Go ahead.
Yeah, thank you very much. So we are now going to a very silent but increasingly common killer that was particularly disastrous last year, heat. So this May that we are just sitting through is hotter than every May, any May you've ever experienced before. And that was true for the last 12 months. Temperatures right now are around 50 degrees in India and Pakistan. Every heat wave that's happening today is hotter and lasts longer than it would have without human-induced climate change. That is, without the burning of coal, oil, and gas. And we also see many more heat waves than we would have otherwise. And the report that we've put together and that you have in front of you today spells out what that means and why it matters. Of course, what temperatures constitute extreme heat differs depending on where you live. A heat wave in London is different than a heat wave in Delhi, but no place on Earth is spared from more extreme heat. The average inhabitant of our planet experienced 26 more days over the last 12 months that were extremely hot than it would it have not been for climate change. But of course, we are not average people. We live in a specific place in a specific country. So for example, if you lived in Ecuador, it was not 26 more days, but it was 170 more days. In other words, in the last 12 months, the people in Ecuador experienced 180 days of extreme heat. Without climate change, it would have just been 10. So it's 6 months of extreme heat instead of 10 days. Extreme heat is dangerous, leading to excess mortality in the thousands at least. Heat harms especially vulnerable people, the elderly, the very young, those with pre-existing health conditions, but also healthy people who are exposed to the extreme temperatures, like outdoor workers in agriculture and construction, and of course people living in refugee camps. It is thus paramount to stop burning fossil fuels, to evade the situation from getting worse, but we also need to adapt. 26 more days of extreme heat on average, that's almost a month. And heat kills, but it doesn't have to kill. There are many solutions, some of which are low or no cost, ranging from individual action to population scale interventions that reduce the urban heat island effect. At an individual level, people can cool their bodies by self-dousing with water, using cooling devices or modifying their built environment, just install shutters, increase shade. But of course, individual action alone is not sufficient, especially for those that lack access to water, to electricity, and to shade. Action at community, city, regional, and country levels is imperative. Cities can develop and implement heat action plans that outline how they will prepare for the heat season, respond to imminent heat waves, and plan for the future. And on a large scale, policies can be introduced to incorporate cooling needs into social protection programs, supplement energy costs for the most vulnerable, or building codes can be updated to encourage better housing. The significant impact of heat waves and the potential to prevent them is why the Red Cross Red Crescent and its partners are mobilizing on the 2nd of June for the Global Heat Action Day. Because if you don't know how dangerous heat is, you can definitely not do any of these matters. And so we need to raise awareness and engage anyone, all communities, in understanding and in what they can do to combat heat. So I can answer questions about the role of climate change in extreme heat and other extreme weather, but my colleague Maya Walbeck from the Red Cross Climate Center is here and can also answer all questions about vulnerability and exposure. Thank you.
Thank you very much to both. Let me see if there are questions. I see Jeremy Lange, RFI.
Hi, thank you. Can you just explain again what is extreme heat, technically speaking, at what temperature do you consider that we can talk about extreme heat?
That's, of course, the most difficult question you can ask, because what extreme heat is depends where you live, but also, of course, how vulnerable you are. So if you live in a city that is extremely well built for heat, then very high temperatures can be no problem. But if you are living in a refugee camp with no shade, much lower temperatures can consider very extreme heat. So in this report, we have defined extreme heat just based on each place on Earth, the 10% average highest temperatures that occur in that region. But with our team World Weather Attribution, we have done a huge amount of studies on individual heat waves, and there we characterize the heat depending on the impacts. So we did a study on the extreme heat in Palestine, Israel, Jordan, and Syria, where it was very hot for just 3 days. So that was what we looked at as extreme heat. So it, as a meteorological, extreme just means rare. So you usually look at the sort of 10 hottest percentage or 5th hottest percentile, which is what we have done for simplicity in this report. But how much that matters hugely depends on vulnerability.
You have a follow-up?
Yeah, but I was meaning you do have a biological limit that you're not supposed to go over. Like the body shouldn't be at that temperature. I don't know if it's 40 something degrees more than a couple of hours, couple of days. Can't you just, don't you have that in the report, that particularly biological limit?
We don't have the biological limit in the report. So the biological limit is based not just on temperature, but also on humidity. And so it's if it's a dry heat wave and you have 40 degrees, that's much less damaging to your body as if it's a very if you have a humidity of 100% and it's 35 degrees, then that's much more damaging for your body. So we don't have that many days yet globally that are above the biological limit, but heat is deadly much below this absolute biological limit, and therefore using just that as a measure would not really characterize the dangers of heat waves today. Heat waves are killing in these 10% above the average, which is why we have used that. Maya, please add. Yeah.
I see Maya wants to say something.
Yeah, thank you so much. I just wanted to add on that very important point that you were raising, Freddie, that heat waves and extreme heat are very contextual and they always bring risk, the risk of impact on human health. So coming from a generally cold country such as Sweden, people here are often a lot less prepared to cope with heat waves, as we lack adequate infrastructure such as air conditioners and cooling centers. And with this limited infrastructural resilience, acclimatization, and risk awareness, populations in these areas may therefore be more susceptible also to heat-related impacts. And to give an example, in 2018, a 3-week heat wave in northern Scandinavia, reaching only 31 degrees Celsius in Sweden, is still estimated to have killed about 600 people in the country, most of whom were older adults who are physiologically more vulnerable to heat. And I think this exemplifies why we should worry about temperatures that may not be universally considered high or extreme, but instead focus on what is high for the exposed community. And this is definitely something we want to help raise awareness about through Heat Action Day that occurs this Sunday. Thank you.
Thank you very much, Maya. Other question to IFRC and colleagues? I don't see any in the room or on the platform. So thank you very much. Thanks, Tommaso, for bringing us this report. I have seen in the notes, in the chat, that they are asking for your notes. So that'll be sent very quickly. Thank you very much, Dr. Otto. Thank you, Mrs. Wahlberg. And let me go to our colleague from ITU. David, you are online for an announcement. I think it's on WSIS and the AI for Good summits. Please.
Yes, I know it's getting late there, so I will get through this, not breaking any new ground, mostly some program notes. WSIS, the WSIS Plus 20 Forum high-level event continues at CICG today and tomorrow, and then moves to ITU headquarters for Thursday and Friday. AI Governance Day, which we've talked to you about and was the feature for those who want to learn more of the 17 May regular briefing with our colleague Fred Werner. That opens tomorrow with the public session in the afternoon, hosting discussions on how to move from principle to implementation on AI governance. That's available to be both physically and remote. And then the AI for Good Global Summit continues on Thursday and Friday with both physical and remote coverage participation available to you. Friday in particular, I'll just flag that at 1 o'clock at CICG will be the press conference for which we've issued a media advisory on brain-machine interfaces. So showcasing that technology as was done last year with the humanoid robots, this year on brain-machine interface technology powered by artificial intelligence. And again, just more on a background note, we have asked reporters, if you can, please RSVP, particularly for the press conference, so we know to expect you either remotely or physically. That'll just help us accommodate for those events. Registration again is open, and we would impress upon you, if you're able, to get over to CCV across from CICG to pick up your secondary badge at an off-peak hour. So maybe sometime today. I know it's busy there for other things, but if you are able, we're in the area to do that, not in the early mornings when we expect the lines to be the biggest. Thank you very much.
Thank you very much, David. Is there any? Yes, Jamie.
Hi, David. Nice to see you. I'm sure you're very busy at the moment. I just had a question about your press release last night having to do with this partner to connect, topping $50 billion US. That sounds like a lot of money. And I'm just wondering, is that money going through ITU? Is it just money that you have rallied together? I mean, that's, you know, is this just private sector and you guys are kind of putting an umbrella over it? I mean, how much of that is actually going through ITU?
It's not. Yeah, thank you, Jamie. The money is mobilized from Partner to Connect, which is a global platform to expand digital connectivity. Those commitments are brought into the Partner to Connect system or pledging platform, which is what the announcement is about. Money doesn't come through necessarily into ITU. It's their industry commitments, their government commitments, there could be civil society commitments. Once they're in the system, this provides visibility over those amounts and allows others to know what's being committed in the system, allows those to be leveraged to see where entities are putting their investments, and also allows for those that might need those investments for those to be able to be seen. So it does raise visibility. Currently, as you mentioned, and at the very end of that release, there's a link on the pledging platform. You'll notice there's just over 50 billion, 50.96 billion in commitments that have been committed to the Partner to the Partner to Connect pledging platform. That's over 900 pledges received from 400 entities and about 140 or so countries. And I would just also say that there is an overall goal of having 100 billion pledged to the Partner to Connect pledging platform by 2026. So part of the announcement yesterday was that there was just topping the 50 billion point, which is the halfway mark towards that 100 billion.
Is it okay, Jamie? Yeah, okay. Is there any other question to ITU? I don't see any, but I think there is a question on the contrary for WHO on the assembly. I don't know if Adela or Margaret want to come to the podium. And Margaret, maybe if you can also come to the podium, because Lisa had put a question in the chat, but I'll ask it afterwards just for your answer. But Fadela, please come, and I'll ask Ben to ask his question.
Déjà, merci d'avoir deviné ma question à l'avance, enfin le sujet de ma question à l'avance, Alessandra. Oui, donc, well, I'll ask it in English because it's of general interest. Just to know what is the timeline this afternoon for the decision on the pandemic treaty. Maybe you have details, and can we hope for an official announcement before tonight so that we can speak about it tomorrow morning? Thanks.
Can you hear me? Yes. Okay. Thank you for the question. Today in Committee A, we will have at least 4 important issues to be discussed: the WHO budget, the global program of work, and also the investment round, and 2 major discussion, one about the amendment to the International Health Regulation and the INB. So what I can tell you is, as you know, these are 2 processes led by member states. So it's up to them to decide what to do with the 2 reports that are already on the website, one about the AHR and the other one on the INB, in 6 languages that you can read. You can see there that some parts of the 2 documents are highlighted in yellow or in gray or bold. So you will see what are the issues that are still to be discussed and negotiated. So to be very short and clear, it's really up to member states to decide what to do with these 2 reports. Do they want to continue the negotiation this week? Do they want to decide on a date to resume negotiation? It's really up to them. So we will let you know end of today in a press release what is the decision of member state. They may also decide to open the discussion and say, we will discuss it later in the week. So it's really up to them to decide what to do with it.
Yeah.
Sorry, following up on that, if they decide in the committee today that they want to continue or make a decision, is that a final decision, or do we have to wait for the plenary at the end when this is finalized? If you could just explain how that works. And also I had a question on the issue of the Palestinian territories, which I think is coming tomorrow. If we have, if you could just explain what's going to happen there and how to follow things.
Okay. So you know that for INB, they haven't reached a consensus. They don't have a final report to submit to the World Health Assembly. So we have the report, what is called the report by the Director General to member states. So with still a lot of issues to be discussed, to be negotiated. So the report we have is the report by the DG explaining what is the progress made since the beginning of discussion on the INB, and 9 meetings took place since then to discuss this report. So it's not a final text, it's the report by the Director General to member states. So as I said, I don't know what will happen this week, what member states will decide to do with this report. It's really up to them to decide the step forward to take this discussion forward.
Yeah. I know there's no deal. I was asking if they decide that they want to continue discussions or if they want to cut off this. I mean, if they decide in the committee, I know that often the discussions, things are happen in the committee and then they have to be approved in plenary. I'm just wondering if we have to wait for a final decision until the end of the week, or if we can just assume that the whatever is decided in the committee is the final decision on which way they're going.
usually what is decided in committee A or B should go to the plenary. We have 3 days, 3 moments in a day until Saturday where the plenary meets, 9, 12:30, 6 p.m. So there are 3 moments in the day where the plenary resumes. So anything that is decided in 1 or 2 of the committees, or committee A or B, should go to the plenary.
And on Gaza?
Can you just repeat the question? Sorry.
What are
Nina?
you expecting to happen and when, and how? Also, are there resolutions around this? If you could just explain what's going to happen on the Palestinian issue.
I need to check if they have decided to open committee B today, because usually it's in committee B that OPT is discussed at the World Health Assembly. Just to let